Hey, welcome to the first webinar of the McLean Hospital Crafting Support Project 2025 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I am very excited to have you with us for a presentation on practical strategies for families to help loved ones return to work or school with Dr. Kim Mueser from Boston University. Before we begin, I'll go over a few reminders. So folks are welcome to change their names for privacy purposes or ask any questions or comments in the chat anonymously. And if you have any questions as we go, please feel free to put them in the Q&A box and we will try to get to them in the second half of the presentation. And we ask that you do use the polls and chat for any audience participation to get the most out of the webinar and to share any comments or resources that you might like as well. We are recording the presentation and Q&A discussion, and when recordings are available, we'll let attendees know. And to continue to improve the webinar series, we encourage you to complete a brief, anonymous, and voluntary feedback survey to share your thoughts, preferences, and ideas for future webinars, because we want this to be something useful for all of you. So this information helps us for quality improvement and maybe share it anonymously in the future with researchers or people who we work with who are interested in expanding this type of support for family services. All right, so let me put the link to the survey in the chat for anyone who might need to go early. Oh, here we go. Okay, great. All right, so for our agenda for today is I will orient us to why we're here tonight for the Crafting Support Project, then we'll go into our presentation and Q&A with Dr. Mueser, and then we'll end with some closing remarks. So I'm going to launch a poll now to get a sense of who is with us this evening. So let me pull that up. Okay, so the question is, what best describes your role? And you can indicate whether you're a family member, person with lived experience with mental health challenges, clinician, none of the above, or you may have intersecting identities as well. Wow, this is one of those quick responses. We've got almost everyone participating already. And we'll close the poll in 3, 2, 1. Okay, so it looks like we have 96% of our attendees are family members tonight. We also have people who may have their own lived experience with mental health and clinicians as well. So welcome to all. Okay, so if you're here tonight, chances are you personally have been in a situation where you may have had a loved one who's needed some mental health assistance or treatment at some point, and maybe you have not known what to do, or maybe you don't know what to do now, or maybe you're helping others who are in that position. And so if you're anyone like myself, you might find yourself without all the answers, and that's okay. And that's why we have this series, to think about how we can bring evidence-based tools and knowledge to people like you so that you feel better equipped with the skills and resources to help you and your family. And what we've done is for this year, created a wonderful lineup of topics, ranging from how to help folks return to work and school today to how to help youth with anxiety, how to incorporate digital innovations, think about housing, and then we'll end at the end of this year with a family recovery night where people will share their own lived experiences with mental health from their personal perspective and that of their family members as well. And for folks who have not had a chance to join previously, or if you'd like a refresher on some of our past topics, you can find them online on YouTube from the past couple of years. We also offer one-on-one coaching through McLean with myself or another clinician from our team to help people use skills, in particular community reinforcement and family training or craft, currently at no cost, though we do have plans later this year to switch to more of an insurance-based model. So if anyone's interested in that, who currently is attached to McLean, feel free to get in touch. All right, and so in a moment, we'll turn ourselves over to our presentation for today. And before we do, I'm curious to know a little bit about where people are coming from today with respect to this topic, about who has tried to help a loved one return to work or school in the past. So let me pull that up. Okay, so you can share if you've not crossed this bridge at all, which is totally fine, or if you have helped others return to work or just returning to school, or perhaps both. helping a loved one return to work and school. Okay, so we'll close the poll in 3, 2, 1. We've got almost everyone. Thanks so much. All right, so it looks like many people have maybe not necessarily been in a position to help a loved one with this yet, but maybe you are interested in doing that in the future. And it looks like we definitely have a mix of people who have helped with work and school in the past. So our topic should be relevant to lots of folks today. Okay. All right. And so I'd like to introduce our speaker for today, Dr. Kim Mueser. Dr. Mueser is a clinical psychologist and professor at the Center for Psychiatric Rehabilitation at Boston University. His clinical and research interests include family psychoeducation, the treatment of co-occurring psychiatric and substance use disorders, psychiatric rehabilitation for serious mental illnesses, including cognitive remediation, vocational rehabilitation, illness management and recovery approaches, and the treatment of post-traumatic stress disorder. His research has been supported by numerous grants from the National Institute of Mental Health, the National Institute on Drug Abuse, the Substance Abuse and Mental Health Administration, and the Brain and Behavior Research Foundation. He's the co-author of over 20 books and treatment manuals and has published extensively, including over 400 peer-reviewed journal articles and book chapters. Dr. Mueser has also given numerous lectures and workshops on psychiatric rehabilitation, both nationally and internationally, and he is one of my mentors, so I'm so thrilled to have you with us here today, Dr. Mueser, and I look forward to your presentation.
Thanks so much, Julie. It's wonderful to be here and to present to this group of individuals. Let's see. So this is going to focus, of course, on practical strategies for helping a loved one get back to either work or school. To begin with, my only disclosures are that all my clothes are made by my son, Jacob Mueser, who is a bespoke hand tailor of suits and shirts with stores in New York. You can't fully appreciate it, but indeed this shirt was made by him. So why focus on employment? First of all, it's considered a critical part of recovery. We know that the definition of a disability involves difficulty in terms of role functioning, such as going to school or work, and therefore helping people get back to work is in effect helping people overcome their disability in many ways. Most people with serious mental illness want to work. There have been about 15 to 20 surveys on this, and almost all the surveys indicate that somewhere between 60 and 80% of people with a serious mental illness express an interest in work. And there's additional ones who are, of course, interested in returning to school, which is an even stronger priority, often for young people who have recently developed an episode of psychosis. Employment is a typical role for adults in our society. And I think for that reason, Julie and I were just talking earlier that employment, as well as returning to school, have the potential to reduce the stigma of mental illness, both the stigma that individuals experience and even more generally. And we also know that work is associated with improved self-esteem, and there's good evidence that it's associated with modest reductions in symptoms and actually a reduced rate of rehospitalization. This is now evident from numerous studies. So there are actually clinical benefits associated with employment, and although somewhat less studied, presumably returning to school as well. I mentioned this that there are a number of surveys of interest that people with serious mental illness have in returning to work. And this is a summary of 11 of the different surveys. And you can see that in most of the surveys, the majority of people have an interest in returning to work. So what I'd like to do is to first tell you about the only really strongly empirically supported program or approach to helping people return to work. And there's evidence that it helps people return to school as well. And that is the individual placement and support model of supported employment. And I want to familiarize you with this model because there may be IPS supported employment programs around where you live. And there's certainly a trend overall across the country for more and more of these programs to be made available. And anybody who is getting who has a loved one getting a treatment in a coordinated specialty care program for first episode psychosis. Most of those programs have a supported employment and education specialist who provide services based on this model. So I'm going to familiarize you with this, and then I'm going to talk about what are things that you can do to support a loved one's interest in work and school. And if you can't find a local IPS program, what are other ways that you can help? So I mentioned that this program is well standardized. A manual exists for it. And it's been a frequently studied program with multiple controlled studies showing that it's effective in terms of helping people get back to work and as well as to school. The principles of IPS are enumerated here. And instead of going over them here, I'm going to actually go over them in the following slides to explicate them a little bit. The first one is zero eligibility criterion, and that means anybody who wants to work can be in an IPS program, even if they have persistent symptoms, even if they have substance use problems, as long as they're out living in the community, if they want to work, they're allowed to join. And so they're not excluded for any reasons, including cognitive challenges that they may experience. Second, the focus of supported employment, IPS supported employment, is on competitive work. IPS specialists help people find jobs that exist in the open labor market and pay the same as others in a similar position, as well as, and often these jobs are working part-time, but they may be full-time jobs as well. And similarly, IPS specialists help people return to or enroll in regular schools, mainstream types of schools. People are not steered into sheltered jobs or jobs that are set aside for a person with a disability. And there's a wide range of different kinds of jobs that people can get. Of course, it depends on what people's experience and training is, but it also depends, equally importantly, on what their preferences or their interests are. And these are just some of the examples of jobs that people have gotten who have been enrolled in IPS programs. Another principle of IPS supported employment is rapid job search. IPS specialists help the person start looking for a job or begin enrolling in school, generally within a month of starting the program. In many ways, the IPS program of supported employment differs from traditional vocational rehabilitation approaches, which usually initially place a primary focus on extensive training and only get around to helping people look for and find jobs following an extensive training period. Those programs are sometimes called train place programs because you do the training first and then you help place the person in a job. IPS does the exact opposite. It's sometimes called a place train model, where the idea is that you help a person find a job related to their area of interest and their skill level, and then you provide the supports to help them stay on that job, or if needed, transition to another kind of a job. So that's why rapid job search is such an important principle of IPS supported employment. And there's actually research that's shown that if you begin a job search rapidly, you're more likely to help people get work than if you postpone it. Because we all know that motivation waxes and wanes over time. And so when somebody is motivated to work or to return to school, it's important to strike while the iron is hot and to honor that, and therefore to begin the work of finding a job or enrollment in school. IPS specialists help people explore the world of work as well as returning to school at a pace that's right for the individual. So you're generally shooting for it to begin within a month, but it can take a little bit longer or even shorter in some cases. Another important principle is targeted job development. This means based on an individual's interests, an IPS specialist builds relationships with employers in their community to learn about the employer's needs and in order to identify qualified job candidates. So employment specialists are often out connecting with different people in the community, drumming up jobs, finding out what employers' needs are, and looking for the right person to fit those needs. IPS specialists make multiple visits to the same employers to develop relationships. And many specialists live in the same communities where the clients are serving, and therefore they can build strong liaisons with employers. Another important principle is respect for individual preferences. Such preferences guide decisions, and the preferences really come in two particular ways. First of all, there's the preference for the type of job that people are interested in, as well as related working conditions. We actually have done research projects showing that when people get into a job that matches their area of interest, that their average tenure, the amount of time they spend on the job, is about twice as long as if they get into a job that doesn't match their area of interest. So preference in terms of type of job sought is important. Another thing that is an aspect of individual preferences is whether to disclose one's psychiatric disability to a prospective employer. Some clients choose to disclose it to an employer, and when they do that, that can be very helpful because the employment specialist or the teacher or the school that they're being enrolled in can be actively involved in helping kind of pave the way for a smooth job interview, for a good admissions interview, and things like that. And then when issues come up, the employer can be in contact with the employment specialist to work out solutions. But some people choose not to disclose, and that is honored as well, in which case the employment specialists play a kind of behind the scenes role in terms of identifying jobs, helping people prepare their resume, helping them practice their interview skills, and troubleshooting challenges that may come along the way. We actually have done a study and shown that people who disclose their psychiatric disability to an employer tend to have longer job tenures, significantly longer job tenures than those who don't, because they can get more assistance from the employment specialist. Another principle is individualized long-term supports. In many traditional vocational rehabilitation programs, once somebody gets a job, there is a limited amount of support provided to the individual after the job, such as for like a month or two. In the IPS program, people are provided with supports after they get a job for as long as they need and want them. There's no artificial time limit on the duration of time that people can receive supports. And similarly, when they enroll in school. Now, that doesn't mean people don't graduate from supported employment. Many people do. But there isn't this imposition of a time limit in terms of the supports. And we know that the supports that people get within the 1 to 3 months of getting a job are especially critical in terms of keeping a job. Another important principle is integration with treatment. Supported employment services, in the form of an employment specialist who provides the full range of services to each individual they work with, are integrated with treatment at the level of the treatment team. Treatment meaning things such as pharmacological treatment, case management, other aspects of psychiatric rehabilitation or psychotherapy and things like that. Generally speaking, the employment specialist, when you have a regular team meeting and the like, employment specialists will come to one team meeting per week, and they will provide updates in terms of how the person is doing in their quest for work or school, and if they're enrolled or working, how things are going. And they can also relay information to treatment team members about things like side effects, problematic symptoms, and so on. And at the same time, they can get often job leads from members of the treatment team that the employment specialist might not be aware of. They can recommend coping strategies. And sometimes this close coordination can also be helpful in terms of addressing potential relapses that are beginning to happen, because the employment specialist can relay this information to the team based on their regular interactions with clients in the community, and the team can take steps to prevent a full-blown relapse. One other important thing about integrating supported employment and education at the level of the treatment team is that sometimes treatment teams don't value the goals of work and school as much as consumers do. And so by having the employment specialist come and participate regularly in treatment team meetings, it can elevate the importance of these very practical and socially approved of goals within the treatment team. One more principle of IPS is personalized benefits counseling. We know that many people are concerned about losing their benefits if they return to work. And yet, all of the different disability compensation programs that people are on, such as SSI or SSDI, allow a certain amount of work without loss of income. And then they allow additional work with some loss of income that is usually more than compensated for by the additional work. But people need to be educated about what the specific rules are in terms of their own benefits package in order to assuage concerns that they may have about losing their benefits. So I mentioned that the IPS supported employment program has been shown to be effective in multiple research studies. In fact, over 25 randomized controlled trials have been conducted comparing IPS with other vocational rehabilitation approaches. Many of these have been done in the US, but they've also been done in other countries. The impact of IPS is similar in urban and rural areas. And the long-term outcomes indicate that improved employment rates are sustained at longer-term follow-ups. And the benefit from the IPS program is not related to client demographic or clinical characteristics. To say a little bit about randomized controlled trials of the IPS model, about half have been done in the US and half have been done in other countries. In most studies, participants were already enrolled in mental health services prior to entering the study. And usually supported employment is provided at a community mental health center, which facilitates the integration with clinical treatment. In most studies, the control group received services as usual, usually some type of vocational rehabilitation program other than supported employment. And 2/3 of the study had at least an 18-month follow-up. So what this graph reflects are the results of the 25 randomized controlled trials of IPS. And what is depicted here is the percentage of people who got a competitive job during the study period. Remember that the study periods, generally speaking, ranged usually from at least a year and a half to 2 years long, some of them even longer. And the black lines are IPS, and the red lines are the control group. And there's one a study, the fourth study, if you can see 04, and under it is CT. The CT stands for Connecticut. 04 is 2004, and that happens to be the Hartford study, which I did with my colleagues at Dartmouth, and that was the only study that had two different control groups, a usual services control group and a psychosocial, a clubhouse control group. But what you can see is that for every one of these studies, the percentage of people who received IPS were significantly more likely to get a competitive job than the percentage of people who received the usual services. So, for example, in the first study in New Hampshire, almost 80% of the people in IPS got a job over the 2-year period, whereas only about 40% did in the control group. And this is fairly consistent across all of these different studies. And this just happens to be organized from the studies that got the very highest rates of employment for IPS versus those with the lowest rates. So the mean competitive rate across these studies was 56% for IPS and 23% for controls. Now, you might be concerned that just getting a job at some point in the study isn't a very strong employment outcome. But it turns out that you find the exact same thing if you look at the number of hours worked, the amount of wages earned, the number of weeks worked, and so on. So the percentage of people who worked is just an indicator of the degree of work that people get over a 2-year period. And then these are the 18-month competitive employment outcomes of 4 controlled trials of IPS. So you can see job acquisition. That one, of course, we've already summarized that people in IPS are more likely to get a job. Working over 20 hours a week, you can see that around half, less than half of the people in IPS worked more than 20 hours a week. You can see that the days to the first job across these 4 IPS studies was significantly shorter than the days to the first job of the control. You can see it was around 3.5 months. And you can see that the total number of hours worked was, of course, much greater in IPS as well. So, how can families help a loved one explore and pursue work or education goals, even when IPS supported employment is not available? Because clearly, if it is available, try to run to the closest program if a relative is interested, and then enroll them in it. I'm going to give a number of guidelines for how to help a loved one explore and pursue work, and these are adapted from our book, The Complete Family Guide to Schizophrenia. And this is what the book looks like. It's available in a paperback, and it has lots of different practical chapters in it. But one of them is focused on specifically helping people get back to work or school. So the first is explore the possibility of work with your relative. And when I'm writing work, we're really meaning both work and or school. So ask if your relative has thought about work or is interested in work. Explore with your relative some of the benefits of work, such as having more money, having something to do, pursuing social opportunities, feeling good about yourself. We should also have in there pursuing personal interests. It could be a passion that the person has had, or it could be a hobby that the person has had and has never even thought about trying to turn into a job or to get a job that's somehow related to that hobby or interest, whether it's music or sports or interest in reading or in journalism. Explore possible concerns that your relative might have about working. So, for example, sometimes people are concerned that the stress of work might bring on symptoms or might be more that they can handle. They might have expectations about having difficulties at work. They may have concerns about the loss of disability income. And in each case, these concerns can be explored and different kinds of solutions can be developed for them. It's interesting because a lot of people are concerned about the stress associated with work, but not that many people seem to be concerned with the stress associated with not working. And in many ways, work can reduce the stress in people's lives because it gives them something meaningful to do with their time. It's valued by other people. It provides some degree of social interaction and social connection. And so for all of these reasons, in particular, the meaningful stimulation associated with it, the chances are that going to work actually reduces the stress in people's lives rather than introduces it. And that may be one of the reasons why getting a job is associated with a modest reduction in the risk of having a relapse and rehospitalization. Helping a relative determine whether more information is needed about work before starting to pursue it may be useful. And the same thing about education. Some people who develop a major mental illness have developed it in college, sometimes even in high school. And we all know that people's vocational goals, the things that they end up doing with their lives, often evolve very gradually during late adolescence and early adulthood. And so sometimes the mental illness interrupts this exploratory process. So, on the one hand, we often try to explore with people, well, what are you interested in doing for work and the like? But on the other hand, there's many people who don't have a good familiarity with the working world. And so exploring with your relative different types of work, whether it's working in a kitchen, a car dealership, whether it may involve aspects of engineering or math or science or sales or anything along those lines, helping people explore the world of work may be something that is critical to sparking an interest that they want to then pursue, whether by going to school or directly applying for jobs. Explore the pros and cons of work with your relative in order to help them decide whether they want to pursue it. It's also sometimes useful to help people think that the decision to look for a job and to try to find work doesn't have to be a commitment for doing that for the rest of their lives. Of course, we are hoping that when people return to work, that it's going to be something meaningful and they do continue for much of their lives. But sometimes people are very ambivalent about it. They're very anxious about it, and they're afraid they're going to go get a job and then they're going to be stuck with a job they hate the rest of their lives. And so it could be useful to free up your relative from this concern and to kind of help them think of looking and finding the right job as a kind of experiment. This is something in our field, in the cognitive behavioral field, we often will call behavioral experiments, going and seeing what something is like and seeing what you learn from it. And so in that way, people don't have to feel a commitment to going and sticking with the first job that they get. They can look at working at a job as a kind of an experiment to see what it's like, and that information that they gain from that then will feed into future types of jobs that they look for. Um, Although IPS-supported employment focuses on competitive work, sometimes people are very lack of a lot of confidence. They're very concerned about applying for a competitive job, and it may be a better way to ease somebody towards that goal, or alternatively, it may be it is a valued goal in its own right for the individual to do volunteer work. The reason IPS has not focused so much on volunteer work is that there's a tendency for everybody in the mental health field to underestimate the real potential of consumers with a mental illness in terms of achieving goals they have. And most of the people with a serious mental illness who want to work a regular job that gets paid wages. But that doesn't mean that volunteer work should be discouraged if the person wants to do it. And we know that in our society, volunteer work is tremendously important in terms of the overall economy, in terms of giving meaning to life and things like that. And so helping people find volunteer work can be a useful thing as well, that may be a stepping stone to competitive work, but doesn't have to be. If your relative is interested in work, explore their job interests. Talk to your relative about past work experiences that they've done. Discuss the types of work that they would like to do. Consider special skills, training, degrees that your relative has that may help in landing a job. And of course, it may well be that the person doesn't have clear job interests, and therefore the what I talked about earlier in terms of exploring the world of work may be very useful for some people. And this is what I mentioned right here. Talk about things, other interests that they have. If they're not sure what they want to do in terms of work, or they haven't thought about it that much, the next thing to do is to try to explore interests that they have, hobbies, sports, theater, and music, these kind of things, in the hopes of being able to look for a job that may have a particular interest or value for the individual. We've already talked earlier about encouraging a relative to explore different types of jobs if unsure about it. And then, of course, helping a relative prepare their resume. And then finding a job. Okay, there's lots of different ways of finding jobs, looking for jobs in the classified ads or online, walking around the business district of your town and looking for help wanted signs. That's what employment specialists do with clients. And a very important one is to activate your social network, the people you know, by letting them know about your relative's interest in work. We actually know that a tremendous number of jobs in both the United States and actually throughout the world are obtained through some kind of a connection. Somebody knows somebody who knows somebody. And by making that connection, you kind of get a bit of a foot in the door, as well as broadening the number of jobs that you can identify, because often people within a social network have unique and interesting ideas and knowledge of jobs that no one person could possibly know within that network. Explore possible job finding resources on the internet. Encourage your relative to get job leads from peer support groups or other social contacts, and this could include their clinical treatment team. It can also be useful to arrange for an informational interview for your relative with someone who is employed in an area of interest that they have. And the aim of this informational interview is helping them understand what the job is like and getting suggestions for how to pursue related work. And then landing the job. Talk over with your relative how you can help them get a job. Consider practicing job interviewing skills with your relative. I am going to mention a book by Susan McGurk and myself. I'll show you the cover of it on the next page. This is a book on cognitive remediation, but it has lots of information about helping prepare people in terms of getting jobs, as well as helping them stay on the jobs by addressing cognitive challenges and helping people develop self-management strategies for coping with those cognitive challenges more effectively. And in this book, there are tips specifically on how to do job interviewing training. And this could be done by a family member just as well as an employment specialist. Let me show you the picture here. This is the book, Cognitive Remediation for Successful Employment and Psychiatric Recovery, the Thinking Skills for Work program. And this is a program that Susan and I developed and has been supported by 6 randomized controlled trials done by both ourselves and other people, and both in the US and outside of the US. So, and then talk over with your relative whether it would be helpful for you or someone else to try to speak directly with the prospective employer on their behalf. The advantage of having somebody speak to the employer is that they can sell the employer on the ability of your relative to do the job, sometimes more effectively than the person themselves can. But of course, that it depends on whether the consumer is willing for you to play that role. Help your relative succeed on the job. So this refers to after your relative gets a job. Think and be alert to the different kind of ways that you could help your relative succeed. Check in regularly with how things are going at work and be ready to problem solve around challenges. Offer to meet with your relative's employer to iron out work-related difficulties. These are things that employment specialists do, and family members are certainly capable of doing it. And I know family members that have done it. If your relative loses a job or quits, don't give up. In fact, I can tell you, in supported employment programs, the #1 reason why people lose a job is that they quit and walk off of the job. They're less likely to be fired than to quit. And that's because they can get frustrated easily. And so helping people build up frustration tolerance, helping them problem solve and things like that can be very useful. But job endings do happen sometimes, and you learn from those job endings. And based on what you learn, you then go and help the person get another job. So it is a learning process that occurs gradually over time for many people. And so that is the end of my presentation. And at this point, I would like to turn it over to Julie and folks for any questions that you may have.
Thank you so much for that wonderful overview of supported employment and IPS. And so I would open up the floor to any audience questions. If you have any, feel free to put them in the chat. Someone asked a question during your presentation, so I'll start us off with that. You spoke a lot about different research studies kind of supported the supporting employment approach. And I think the question was about, how do these ideas relate to people recovering from psychosis? And so could you speak a little bit to how often these studies are typically involving people who are experiencing things like schizophrenia or other psychosis?
Sure. Thanks very much for bringing it up. The IPS model of supported employment was developed for people with a serious mental illness. And I'm not sure about the overall average percentage of individuals with schizophrenia in the IPS studies, but my guess would be around 60%. There are a number of studies that have been done in which all the participants have had a schizophrenia in them. Remember, I mentioned the study done in Hartford. That one had about 200 people, and 75% of the people in that particular sample had schizophrenia or schizoaffective disorder. So the effects of IPS-supported employment are quite prominent and significant for people who have a schizophrenia. And some of those people may have persistent psychotic symptoms. Other people may not have those particular symptoms. But in general, having the symptoms is not a huge interference. Sometimes people need to be taught strategies for coping with the symptoms and the like. But in general, it is not something that prohibits people from being able to get and keep jobs. And in fact, here's an interesting thing about psychotic symptoms, symptoms like hearing voices and so on. We know that when people are in some kind of a structured activity, that the extent of those psychotic symptoms, and it could also be things like delusions of reference and things like where they think other people are talking about them. Those symptoms tend to be less severe when their attention is structured in a meaningful way, like work. So going to work can actually have a modest effect on reducing some of the psychotic symptoms themselves. So the basic principles of supported employment apply very, very much to people with schizophrenia. And the other people who have been in these studies have generally been people with bipolar disorder, people with
Mhm.
severe major depression, and there have also been studies of people where primary PTSD has been their psychiatric diagnosis.
Great. Thank you so much. So it seems like it's something that could be relevant for a lot of different people who have been included in those studies. So
Right.
one of the next questions is somebody has a loved one who has a job already, but she's been on a break from that job for mental health reasons, I'm assuming, for about 6 months. How can a family ease her back in because the daughter may be feeling somewhat anxious, understandably having had this long break?
Right. Great question. Part of the answer depends on um, if the reason she's not working yet is because she feels anxious and not ready to return, or whether maybe other people have concerns about her being ready to return. Let's just take the first instance to begin with. Sometimes when people have a relapse, they are afraid, and then once they may go into the hospital, get their symptoms, stabilized, and then sometimes they're afraid of changing things when they come back out again. This also happens soon after people develop a first episode of psychosis because the symptoms can be very disturbing, and then people are afraid of rocking the boat. If they make a change, maybe the stress associated with that change will bring on the symptoms. And so in those situations, helping the person talk about and review different strategies that they have for coping with stress, having a relapse prevention plan for identifying early warning signs of relapse, and identifying other sources of support that can help them have a certain kind of protection, from the relapse, can be an important thing to do, and can help give them the self-confidence that they need in order to return to work. Um, if the concern about somebody returning to work is somebody else's concern, then what I can say is that we actually know that when people want to return to work, honoring somebody's desire to return to work is the single most important thing.
Mhm.
And it's not uncommon for somebody who's had a job and then they've had a relapse. As soon as that relapse has been controlled, managed, sometimes as little as like a few weeks later, they're able to return to work and they benefit from that because work offers a kind of a routine and that helps structure people's days in a meaningful way.
Thank you so much for bringing that up because that's another question that had come up with other people that I've worked with. Their loved one is ready and rearing to go back to work, and the family might be a little bit concerned, like, is it too soon? Is it not? So it sounds like, in general, the rule of thumb would be to try to return to work as soon as that person wants to.
Generally speaking, yes, because even you may have your doubts, but there are some people where work is a really important part of their identity,
Yeah.
and that even though it may seem like it's fairly soon after a relapse, the returning to work is a really kind of healthy thing that you wanna honor, and the idea is to try to put into place certain safeguards if you have concerns and things like that, but to really encourage the person to pursue their goals in that way and to help them.
Great, thank you. Quick follow-up question to that. Someone asked if you could briefly expand on an example of what a relapse prevention plan could be for those who may be
Sure.
less familiar.
Sure. Just so that people know, relapse prevention plans are they are an approach that involves developing a plan to prevent relapses, as you might imagine. And the idea behind them is that when relapses of symptoms, and we call a relapse when either a person who isn't having particular symptoms begins to have them again, and not only begins to have them, but it begins to really interfere or worsen their functioning. Or if somebody has persistent symptoms, a relapse is when the symptoms get significantly worse and interfere with functioning.
Mhm.
So the thing about relapses is that they tend to occur relatively gradually, usually over a period of several weeks rather than hours or even several days. And before a relapse happens, there are usually subtle changes that may occur in the individual that can be picked up and identified. And these changes are sometimes called early warning signs of relapse. So you may have one person where they are a little bit cognitively confused more than they used to be. Or you might have somebody who becomes more socially withdrawn. They're not taking dinners with the family the way they used to be. Or the person might have symptoms of depression. They might seem, more depressed. Or in some cases, the early warning signs are the beginning of a particular symptom, like somebody who hasn't been hearing voices begins to hear like a few voices. It hasn't affected their behavior and their functioning yet, but so it's an early warning sign of a full relapse. So the idea is that a relapse prevention plan, when this is done clinically, like in family psychoeducation programs or in programs like the illness management and recovery program, what you do is you spend time with the person, and sometimes with the family, of course, identifying what their specific early warning signs of relapse were based on the last relapse that they had. And then you identify really just one or two or three signs that are important signs. And then what you do is you develop a plan for what are you going to do if these signs of relapse occur. Now, generally speaking, the most important thing, you can do things like try to reduce stress and so on, but usually if you arrange a special pharmacological appointment, the psychiatrist can give a small increase in the dosage, and a small increase in the dosage of the antipsychotic medication can prevent a full-blown relapse from happening.
Mm.
And so what you do is you kind of walk through the steps of how should a family member or the client respond if a relapse, if the early warning signs of a relapse are identified. And then we actually like to try to role play that out. So relapse prevention strategies are taught in family psychoeducation and illness management and in like the Navigate program. But the basics of relapse prevention and developing a relapse prevention program are also covered in one of the chapters in that book, The Complete Family Guide to Schizophrenia.
Great, thank you so much. So we have a couple of points that are coming up in the questions. So one is any special advice for folks who may have younger adult relatives, let's say, very early 20s, maybe having mental health concerns like bipolar disorder, but also substance use problems, and still is in that age where there might still be some brain development happening as well. And you know, if we have sort of this attitude of I've got it, I don't need help, despite perhaps some executive functioning challenges, how would you recommend a family member to help be supportive if it seems like from an outsider perspective that person may need some additional help, but are not necessarily open to it?
That's a great question, and a very common challenge.
Yeah.
Of course, we have to remember that young people are very often rejecting young people during this period of time. When they're establishing their own independent identities as adolescents and young adults, quite often refuse to take the advice of their older, more knowledgeable family members and
Of
other
course.
people. So it is important to not over pathologize that,
Mhm.
if you know what I mean, in terms of to recognize that this is a natural part of development.
Yeah.
Having said that, generally speaking, the best thing to do is to try to align with your relative primarily around helping them achieve their goals. And if you keep focused on helping them achieve their goals, then if they begin to experience difficulties of things interfering with achieving goals, like they're not so good at solving problems when they come up on the job or at school or things like that, as long as you maintain your relationship and focused on helping them achieve the goal, then what you can do is you can process with your relative different possible reasons why they're having difficulty achieving the goal. And so the idea here is to help your relative discover or see that they're having a particular challenge in a particular area in order to kind of motivate them, get them interested in making a change in order to achieve their goals without you as the relative directly pointing it out. And that's, of course, not an easy thing to do. But this is what the essence of motivational interviewing is.
Mm-hmm.
In motivational interviewing, what you do is you try to align with the person around their goals, and then you try to process and identify obstacles to those goals in order to help them develop an awareness of how those particular obstacles can in fact be overcome. And that's the essence of how motivation is harnessed. So, for example, in substance use problems, people who have substance use problems, rather than trying to point it out directly to them, which people are often very resistant about, helping them pursue personal goals they have, such as getting to work. And then when substance use interferes with achieving goals like that, to explore the interference achieved and to support considerations that the person might be willing to change. But what you're trying to do is to help them develop that insight and awareness, and you're trying to arrange the conditions in which that can happen through a supportive relationship.
Great, thank you so much. We only have a few more minutes before we have to move to closing remarks, so maybe we can keep some of the responses briefer to these next questions. Okay, so the next one is, any additional support or advice for folks experiencing cognitive difficulties while looking for a job or attempting to work a job?
Yes, there are lots of different what we call cognitive self-management strategies. A cognitive self-management strategy is something that you can do. You don't need to do it on the computer or anything. You can do it and integrate it into your life, and it can help improve your cognitive performance. So, for example, repeating back somebody's name is an important way of improving their ability to remember their name. Reducing distractions in the work environment is a good way of keeping focused attention. There's many different strategies for improving memory. In the book that I mentioned by myself and Susan McGurk, we have 10 different handouts on topics related to cognitive self-management strategies. We have handouts including improving attention and concentration, improving memory, improving planning, problem solving, and we even have some addressing kind of motivational areas like challenging negative thinking and being aware of your strengths. And these are very handy. You can go over them with your relative. And we actually have very good evidence that helping people practice and incorporate these strategies into their lives, not only does it overcome many problems that they experience, but it actually improves their cognitive functioning, just these self-management strategies.
That's great, thank you. So a big question by a couple of folks is, well, where can people look and find, an IPS specialist? Is there a particular website that you would recommend or resource to get people started?
There is an IPS website, but unfortunately, I don't remember it offhand. I think it is. I can ask. Do you happen to know, Susan, the website for IPS? Okay, we will look it up. I believe if you simply looked up IPS or IPS website, you'd be able to find it.
I'm
Either
thinking, is it
in the next minute or
IPS,
two, or share it.
ipsworks.org? Does that sound familiar?
That's probably. Yep, that is it.
Okay,
And
I'll
there's a
put that in the
Center of
chat for
Excellence
folks.
for it that is part of Columbia, New York State.
Yes, I think I saw some familiar faces and names on that website, so it seems like
Right.
the right one. Okay, great. So yes, that could be a great resource for people in the United States at least. Wonderful. Another quick question was, Any advice for jobs for people who have experienced felonies when acting during psychosis?
Yes, interestingly, there are many jobs that people with a criminal justice involvement or record can still get. There are often entry level jobs. They may be jobs working in, for example, kitchens and in sanitation.
Mhm,
Certainly, jobs involved in sales. Um, one of the things that you need to look at is whether there's a criminal background check that is a part of it, and
mhm,
therefore for some jobs, being open about the criminal justice record and kind of explaining potentially circumstances like the person might have had a
mm,
substance use problem,
mhm,
and now they've really been working on getting that under control. They're very motivated to work. People will give somebody who's had criminal justice system involvement a second chance.
mm.
What they care about is that there's the motivation to work and contribute to society.
Yeah, definitely. Thank you. Um, is there an analog program to IPS to assist someone to return to college, or can people use IPS to also return to college?
Principles of IPS can be applied to help people return to college as well as to whether it's completing a GED, high school, in programs for people who are recovering from a first episode of psychosis.
Mhm,
There is a set of components of comprehensive programs called coordinated specialty care. And one of the components of those programs is somebody who provides supported employment and education services. And the
mhm,
reason why that could be especially important for a younger individual is that, of course, some people want to return to school, some want to return to work, and some want to return to both. And so sometimes the employment specialist is working on both goals at the same time, and people may switch back and forth. So many of the same principles apply. There are unique challenges with helping people return to a school. School, in some ways, can be a little bit less flexible than work can. But helping people return is a very important thing to do. And we also know that when people come from especially kind of like middle class families where educate everybody in the family has like a college degree, not getting that college degree can really be a source of feelings of lower self-esteem and or demoralization for individuals. So it could be important partly socially as well as improving their standing in the workforce.
definitely. Thank you so much. I think we'll have to wrap up questions there. So I'm just going to share my screen to finish with some closing remarks. Okay. Um, so for folks who are looking for some additional support, whether it be through coordinated specialty care programs, with our um, program at McLean on Track with Allison Nelson Elliott, for instance, or if you are looking for other supports through McLean, we have some listed here. Um, if you have feedback for our presentation, please feel free to fill out our survey. If you take a moment to do that, it should only take a minute or two. In terms of additional resources, though, I will also put in the chat a PDF with some resources. I'll have to add the IPS site to this for the future, though. And our big team of people who have helped put this together are listed here. And our next family webinar will be next month, Thursday, May 8th from 5 to 6 p.m. with supportive parenting for anxious childhood emotions or SPACE with Dr. Eli Leibowitz from Yale School of Medicine. So we really look forward to seeing hopefully many of you there if that's of interest. And if you have any questions for me, feel free to get in touch. My email and phone number are here. Dr. Mueser, is it okay if I put your email in the chat as well in case people have
Ab-
questions?
Absolutely.
Okay, great. Let me see if I can add that there. Okay, wonderful. So thanks again, everyone, and I hope you have a wonderful night. And thanks, Dr. Mueser, for joining us.
Thank you for having me.
Take care.